We're delighted to be launching SAMH's new 3-year plan. We're Scotland's mental health charity, and we have been listening to thousands of you who've been telling us about what you would like to see happen next in mental health in Scotland. We have heard you and we want to be there for you. Our plan is packed with ambition, and together with our partners and working across communities in Scotland, we seek to do more than we've ever done before. There is a mental health emergency coming in Scotland, and we won't wait. The demand for psychological therapies in Scotland is rising. At SAMH, we don't believe the system will be able to meet this demand in the coming years. People wait far too long and often don't get the support that they need. So our commitment is to be there for people. We will transform our own services and our own supports so that people will ask once and get help fast. The last 18 months has been a tough time for all of us, but we know through SAMH's research that those with pre-existing mental health problems have fared particularly badly. 50% of those people told us they had not received the care and treatment that they needed during that pandemic period. And demand on mental health services and for information has been unprecedented and continues to rise. So we're calling on the Scottish Government to radically redesign the mental health system to meet these rising needs. Children and young people have been through so much over the last 18 months. Disrupted education, time away from family and time away from friends, and months of uncertainty. And for those young people who have been seeking help around their mental health, 1 in 4 have been rejected by the mental health system. That's got to change. SAMH will campaign as a priority to make sure that government, councils, health boards and all other authorities do all that they can to provide the supports for young people when they first seek help around their mental health. For our part, we are going to prioritise transitions through school to college and university and to workplaces, sometimes for the first time. At SAMH, for many years, we've been working hard to challenge stigma and end discrimination as it affects those people with mental health problems. We're proud to have partners See Me working alongside us to this end. And in the next period, we commit to do even more, as there is more to be done to end stigma and discrimination in Scotland, and we will do that working alongside people with lived experience as we create a social movement who can achieve social change. Suicide can devastate lives, it can devastate communities. Every day in Scotland, 2 people on average die by suicide. At SAMH, we think that's too many. So in our new 3-year plan, we promise to do more on suicide prevention than we've ever done. We will raise awareness, we will campaign relentlessly, we'll provide training for those of you who want that, and we will fund research because we believe at SAMH that every life matters. We believe in the power of sport and physical activity as a means of preserving and achieving good mental health and well-being, but also as a vehicle to recovery for those who have mental health problems. We are committing again to this agenda, working with our ambassador, Sir Chris Hoy. We will run national programmes. We are training every active schools coordinator across the country so that we can build support and infrastructure where people undertake sport and physical activity in Scotland to achieve our aim of mental well-being for all.